एटलस एटलस एक रोमन मिथोलॉजी के अंदर हुआ है जिसने जमीन को उठाया हुआ है वो आई थिंक टाइटन्स वी टॉक अबाउट देम एज टाइटन्स दो इसी ने एटलस ने आपका पूरा सर उठाया हुआ है लाइक दिस सो दिस इज द नेम behind for that so let's see the atlas here so this is our skeleton let's look at the atlas so this is this one that is giving support to the occiput that is giving support to the base of the skull so this is atlas you will see it has a very peculiar shape what differences can you find it does not have a body it does not have a body that's a very big thing it does not have a body and it does not have a big spinous process so what does it have so this part if you look at it here this part these are divided into two arches there is anterior arch and there is posterior arch so this is the anterior arch this is the posterior arch you can extrapolate all the information from this picture these are the two arches and on the midline there is this tubercle there is posterior tubercle and there is anterior tubercle simple the rest of the part that is called the lateral mass that is the lateral mass and here is the transverse process so these are the parts so we just talked about the arches there is the anterior arch with anterior tubercle posterior arch with posterior tubercle let's talk about the transverse process it will have the same anterior and posterior bars but there is only one tubercle that is basically the posterior tubercle that is surviving here foramen transverse serum is on the same point and that's it and the articular surfaces there are two articular surfaces one on the top aspect of the let me remove the pen one on the top aspect of the lateral mass and one on the bottom aspect of the lateral mass so these the top aspect this is helping in making the joint with the occipital bone occipital condyle that is making the atlanto-occipital joint as you can see from here this is kidney shaped and if we look from the side if we look like this it is concave it is having a dip if you look on the inferior aspect you will be able to see the this is the inferior Atlanto-Axial joint it will be made here it is usually circular and it is roughly flat as compared to the Atlanto-Occipital joint which movements are possible between the two the flexion movements are done on the top joint Atlanto-Occipital joint and is mostly anteroposterior flexion and this joint it helps in the rotation so when we rotate your head your atlas moves along with the rest of it and we did most of the things we're just left with one thing that is the articular process here you can see this is the articular process we'll just look at the dens in the next atlas axis slide so this is the articular process where the dens the prominence of the second artery vertebra that makes a joint here and that leaves us with one last thing there is a medial prominence in the lateral mass this the medial aspect of the lateral mass there is a prominence this prominence gives rise to the attachment of the transverse ligament this ligament so here the transverse ligament is attached and in front of this the dense bone comes and it helps to place dense in its position and support and stop its uh, sliding front or back of it and this is the ligament that's the point that may break during the hanging fracture and the dens goes back into the spinal cord as the last act of life so that's about it You can take a screenshot for the revision. Otherwise, we talked about the wider cervical vertebra. I did not use that word. It does not have the body centrum. There is anterior arch, there is anterior tubercle, there is posterior arch, there is posterior tubercle. On the I did not mention that on the top of it there is a flattening of the posterior arch. Actually, the vertebral artery, as it was moving over the posterior arch into the vertebral canal to go into the foramen magnum, so it was passing right here. So there is a groove for the vertebral arch. There is a lateral mass on the superior aspect. There is facet. In the inferior aspect there is facet. The upper facet is concave, kidney shape, making Atlanto-Occipital joint. The inferior facet is relatively flat and round to oval in shape, and it is making Atlanto-Axial joint. Then there is a transverse process with the both anterior posterior bars. There is no posterior transverse, and there is only one tubercle that is the representative of the posterior tubercle. So here is the axis